Welcome. Today I'm going to be talking about how to optimize the choice of cage that you use when doing different interbody surgeries in degenerative spine surgery. So when we think about what we want to get out of our cage, generally speaking, we want to get indirect decompression, we want to achieve fusion, and we want the cage to help with a reconstructive technique, which could include fixing a scoliosis or reducing a spondylolisthesis. So in general, when we think about the different directions that we can put an interbody cage into the spine from, we're thinking about a minimally invasive TLIF approach, a lateral approach, or a direct anterior approach. And while the goals of what the cage can accomplish are all going to be the same, how we deliver the cage there is different in all of these procedures, and potentially the risks of how that cage gets there are different. So let's go one by one in terms of how I like to choose what type of cage I'm going to use in the different types of surgeries that I'm performing. So let's start with the minimally invasive TLIF. The minimally invasive TLIF is a workhorse procedure for us where we are taking a more posterior approach. When replacing a cage in a minimally invasive TLIF, I like a cage that is going to be articulating. I like to place that cage very anteriorly. I generally like a cage that's a titanium cage because it allows for a larger footprint, and I want that cage to expand. Why do I choose that type of cage and that approach? Is because generally in a TLIF, we are working through a small window, but we still want to deliver the largest cage possible. So think about the ship in a bottle. We want to get through a small space and deliver a large implant. And that's why I believe an expandable implant in particular can be extremely helpful in a minimally invasive TLIF approach. Once we get that good surface coverage, I think having material such as titanium or some sort of metallic end plates which will allow for bone ingrowth can be very valuable. Let's now move towards the lateral surgery. So in a lateral surgery, we have a larger window. We're able to implant a larger cage. What I like to make sure when I'm doing a lateral is oftentimes we are doing these surgeries to restore lordosis or to correct a scoliosis. So when I'm thinking about my cage options in lateral surgery, I'm really thinking about options that are not expandable, but that do provide a wide footprint, both from the pedicle to pedicle and beyond, also from anterior to posterior, and I can really start with a larger cage that I can deliver into the disc space. Again, having some sort of a metal cage is my preference because I do believe that it helps with subsidence and it also helps with creating a surface that allows for better fusion. Ultimately, because we want to restore lordosis, I think having cage options that can be anywhere from neutral to hyperlordotic at 25 or 30 degrees is valuable, and I'll decide what kind of lordosis I'm going to use depending on what the goals of my surgery are. Finally, let's move to let's move to ALIF. So the ALIF procedure allows for the insertion of perhaps the largest cage because it really gives us the biggest window to work through. This is going to sometimes be dependent on the exposure that we have. When I'm doing an ALIF, because oftentimes at a single level, I'm going to do what's called a standalone ALIF, I like to choose a cage, again, that has some metal on its surfaces in terms of the end plate contact, because I think that that really allows for the enhancement of bone ingrowth and ongrowth, and which will ultimately help with your fusion. I like multiple lordotic options because generally speaking, when we are choosing an ALIF, it is a true reconstructive technique where we want to correct a deformity and add lordosis at the base of the spine where it's so important. For me, one of the most important things when I'm choosing my ALIF cage is the ease of insertion of that anterior fixation. I'm not putting a lateral plate on, so I like a standalone device that can have an integrated screw fixation or perhaps blade fixation, and allowing my access surgeon a little bit of ease to just expose the disc space and not have to mobilize the vessels more than they need to be can often be helpful. And so to have some sort of an option such as that is my preference. I hope this has helped you guys in terms of determining what the different options are in cages, what my preferences are. I think while the goals of the cages are always the same despite the type of surgery we're doing, how they're delivered and really the road that we have to get that cage into the space varies. And that's why, while certain things about the cage have similarities, when you're thinking about doing these different approaches, you do want to be cognizant of what your options are so you can deliver the cage in the safest possible way. Thanks for listening.